Many patients can benefit from fractional laser resurfacing. In my practice, I use this technology regularly for patients with acne scarring, deep wrinkles and lines, melasma, sun damage, and other pigmentary disorders, as well as surgical scarring and keloids. One of the uses of this device that I've adapted more recently in my practice is using it for treatment of actinic keratosis. This is a useful procedure because patients get a cosmetic benefit as well as a medical benefit out of this treatment. And I do this procedure for both men and women with actinic keratosis with fairly good results. I also use this technology for treatment of keloids. I usually combine it with intralesional injections with Kenalog and use the 1550 wavelength of this laser to resurface the keloids and break up some of the collagen tissue. For patients who are getting a full facial and neck fractional resurfacing, I usually advise them to make sure they're using sunscreen on a regular basis prior to the treatment, and also we stop treatment with any retinoid products that they may be using, whether that's prescription retinoids or retinol that's over the counter. For patients with darker skin color, I sometimes pretreat with hydroquinone for a month once daily to decrease any pigmentation that may be a problem post-laser. Patients with dark skin, I also prescribe hydroquinone after the treatment for a month once daily to decrease any post-inflammatory hyperpigmentation. Pain control is very important when performing this type of a procedure. All patients in my practice have topical anesthesia applied for about 20 to 30 minutes. This is specifically important to be rubbed into the area of the hairline and around the earlobe and ear area because those areas tend to be the most painful. We also use cooling anesthesia during the procedure. So in this video you could see that the cold air is directly attached to the handpiece. Sometimes I'll have one of my assistants actually hold a hose with cold air coming out and sort of cool the patient as we're performing this type of a procedure. In my experience, most patients do very well with topical and cold air anesthesia and do not have major pain issues. Pain is also a question that patients commonly have post-procedure, and I would say that in my experience, no patient has ever required more than over-the-counter pain medications if they do experience pain, and that happens very rarely in my experience. Technically, it's very important to mark a patient's different anatomic areas to make sure that all of them are being treated, but even more importantly, to make sure that they're not being treated twice and we're not treating the same area over and over, because if you're over-treating, you can certainly cause a local burn. So this particular patient was marked with a eyeliner pencil, and you can see different zones being marked. The area around the lips is very delicate, so if you're just starting to use this procedure, sometimes it's useful to put a topical ointment, such as Vaseline or Aquaphor, on the area to make sure that the lip is not being lasered. I also ask the patients to bite down on the upper lip when we're performing the procedure on the upper lip area, and bite down on the lower lip when we're performing the laser around the lower lip area. The device we're using in this particular video has two wavelengths, the 1550 and the 1927. The patient in this particular video had two concerns. One was some mild acne scarring, and two was some pigmentary problems and melasma. So the initial 4 passes of this particular laser are done with the 1550 wavelength, which is supposed to help with acne scarring, some wrinkles, and resurfacing. And then the 1927 was performed for another 4 passes, and that is more of a superficial treatment for melasma or pigmentation. Post-care instructions are also very important for these patients. We want to make sure that they're applying a topical moisturizer or something greasy, is what I usually recommend, immediately after the procedure and then for several days while they're peeling. Most patients will experience about 2 to 3 days of downtime with some redness. That's especially true for the 1550 wavelength. For the 1927 wavelength, they look more like they've had a sunburn, so a lot of the brown spots will actually pop out a day or two after the procedure. But moisturizing is vital for these patients. It's also very important that they use sun protection and sunscreen on a regular basis. on a sunny day or a day with a high UV index, will actually apply sunscreen on the patients before they leave the office to make sure that they're sun protected. Patients will experience some peeling for the approximately 2 weeks after the procedure. It's very important to instruct your patients not to peel the skin and just let it sort of flake off on its own. More moisturizer usually will help with the peeling if severe peeling does occur. I think it's very important to understand how fractional laser resurfacing can be positioned in your practice. In my mind, this procedure, as far as downtime and also the results, is somewhere between a procedure like microneedling with platelet-rich plasma and something like fractionated CO2 resurfacing. So patients will have more downtime than they will with microneedling with PRP, but they'll have less downtime than they would with fractionated CO2 laser. And I think explaining that to the patients is very important so they have realistic expectations of their results and also of what their downtime would be.